Okay.
Denise, it says it's recording.
Cool. Thank you for that confirmation. All right, well, it's 4 minutes after, and I'll go ahead and get us started, and we'll do introductions after my opening reflection for us all. And so as people continue to trickle in, don't worry, we won't miss. We'll have everybody just quickly after this go around and introduce, say their name, and say where they're from within Catholic Health. So again, welcome everyone. I'm Denise Hess, the Director of Supportive Care for the Catholic Health Association, and really glad you took this time to join us for this information session about the Circle of Life Award. So for today's reflection, I want to tell a story. It's a true story of a palliative care program at Little Company of Mary Hospital in Torrance, California. It happens to be a program that I was a part of for over a decade. And it just so happens that they are the most recent Catholic-sponsored recipients of the Circle of Life Award. So I'm going to go back in time, many years, back in the day when the program at Little Company of Mary was actually pretty average. They were not connected to an academic medical center. They were not at the forefront of research. Their team was not staffed with palliative care celebrities, and really most important of all, they were not flush with resources. Just want to make that clear from the get-go. But what they had was a vision, and specifically a vision to innovate. But really, truth be told, they were not interested in awards. They really liked doing new things. They liked pushing the envelope toward better, more holistic patient care, whether or not they were recognized for their efforts. And in a way, I would say this to them too, they were too humble. I think about the saying, too much humility is pride. So, but in spite of that, they had some very supportive champions amongst the hospital leadership. And these champions knew that this program was actually going above and beyond the minimum requirements. And so a years-long, gentle nudging process began where the hospital leaders would try to convince the team to apply for the Circle of Life Award. And the team would always find a reason to just not quite make the application deadline. And this went on for years. But finally, their gentle nudging found its mark, and the team did apply for the award. And at that point, they were doing really good work. They had a strong partnership between the hospital and their hospice. They had peds palliative care. They had pediatric hospice. They used standardized patients to train their volunteers. And they had received the Joint Commission certification, advanced certification in palliative care. So they applied, but they did not win that year. They received the Citation of Honor, which is not nothing, but they were not the main awardee, as you'll learn how the award works. And really importantly, this was more than enough for the team. They celebrated, they knew they were doing good work, they felt recognized and honored, and they were fine with that. So they got back to work, but because of the Citation of Honor, they actually received additional resources. So they were able to staff up, and now they had a complete interdisciplinary team. As a result of that, their program became more mature. They started doing what they always did again, but in new ways. They rolled out new initiatives around primary palliative care, outpatient palliative care, all clinician in-house communication training, modifications to the electronic health record to capture goals of care and advance care planning decisions, employee well-being initiatives for all staff, not just hospice and palliative care, and new partnerships, and in short, you get the idea. They just kept on innovating. And as you may have guessed, after several years, the same leader champions began nudging them to reapply. And it turns out all along, their leaders were, of course, very happy they got the Citation of Honor, but they wanted them to win and get the big prize, be the number one. So eventually, again, they did the same dance, and the team caved in to the gentle pressure and applied. And this time they won the award and they lived happily ever after. Not really. So yesterday, I chatted with the lead of this award-winning Circle of Life program leader. And I told him we were going to meet here today. And he unfortunately can't join us, or he would have been here to tell this story himself. But I asked him to reflect on their Circle of Life experience. And what did he talk about? He talked about all of the innovations that he would highlight if they were going to reapply for the award now. So he talked about their innovative approaches to philanthropy and their new partnerships with the local Japanese community, their mentoring program, their DEI informed staff well-being, on and on. You get the idea. So why do I share this? First, I don't share this to intimidate anyone and make you think, oh my gosh, we aren't doing the half of that. There's no way we should apply. That's not the point. I share this story to remind all of us that really, ultimately, especially for those of us in Catholic-sponsored healthcare, this is not about an award. This is about a vision. And a vision that I know all of you on this call already have. A vision that I know all of you on this call will continue to doggedly pursue, whether or not anyone gives you an award for it. But there's the rub. You should get an award for it, because the award would be a natural outgrowth of the innovative, spectacular, incredible work you're already doing. So my encouragement and exhortation to us all is, don't be too humble. Remember, as the saying goes, too much humility is pride. So with that, I would like to introduce my two esteemed Circle of Life Award Committee colleagues. We have Connie Dahlin on the call with us, and she'll jump in really shortly here and give a fuller introduction of her stellar credentials. And we have Jane Jeffries with us, who actually is on staff at the American Health Association and is the head honcho of the Circle of Life Award for us, and the guru. She has all the answers about the practical nuts and bolts. And I'm looking around, I see we have about 21 folks, and it's 12 after. I think we're just going to go right in and have Connie jump in and start sharing your part in the interest of time. And then we do have time at the end for Q&A. So those of you who speak up at that point, please introduce yourself. And we are recording this, as you all know. And so if you want to rewatch later, you have questions later, we'll give you ways to reach out to us and continue this conversation. So Connie, welcome, and thank you so much for giving us your time today.
Well, thank you, and it's lovely to join you all. So my name's Connie Dahlin. I have been a palliative care clinician my whole career. I have practiced in hospice, palliative care, in the home setting, long-term care setting, clinic setting, acute care setting, as a clinician educator, and really thinking about also administration. So I have been on the committee for a number of years, probably. It's funny, I can't even remember the exact time, but anyway, suffice it to say, over a decade. And, the Circle of Life is an amazing award, right? Because when it started, there was nobody recognizing excellence in end-of-life care or hospice. And if you think about the climate, it was still taboo to sort of think like, oh, we're going to look at care of people at that point who are more dying, and to where we are now, which is looking at serious illness. And so what the award is really about is saying, we all know that there's quality palliative care. And quality palliative care is not based on one person or one personality. It is based on a team approach in which the team is really going above and beyond a survey for the hospice COPs or joint commission, just to the regular one, but really saying the team has looked at itself and is using everybody to the fullest scope of practice, working collaboratively, and then sort of picks an area that they understand is not being served. And so that happens in like reaching out to think about some of the vulnerable populations that we have not taken well care of, and that might be long-term care. We had one organization that applied and it was so integrated palliative care as part of their mission and vision for everything that they did. They didn't even know how special they were, but it was one of the best long-term care parts where they looked at the individuals when they came. They started thinking about some of the principles of advanced care planning. They were doing geriatric pain and symptom management. They were getting people into hospice, but it was seamless. It wasn't like, oh, wait, we're on an algorithm. It was just like, how do we do the best care along the trajectory? Other populations have thought about, or other programs, looking at, who is in their community. And we had another hospice that applied that was really doing stellar work with the community, where they spent 2 years working with the community to gain trust about hospice principles and why in that community, the Hispanic and Latino community wasn't using hospice. Now, we in palliative care like our words, and we will create these great patient education documents. And they took like an 18-page document and condensed it to 4. Remember, Spanish words are longer, for the community. And they created telenovelas for the community about hospice and palliative care. So still doing the care, but had reached out to this population to find out not what they thought they wanted, but what the community was telling them. And then, also they were starting to work on the African-American population, again, to be community brokers, not to tell them what they could get, but to find out what they needed. The other part that's kind of grown over the last number of years, and then I'll turn it over to Jane, is it used to be, this started out as an acute care award mostly, and it was some of the newer programs. But I can tell you that some of the people who won 20 years ago wouldn't win now, because we're really looking for beyond just acute care. We're looking for connections so that an acute care program would be working with a community or working with a clinic or working with a hospice to say, we recognize there's some places that we can't do it all. And so who are we already working with? Who are we already doing a stellar bereavement program? Or we're, looking at within COVID, how did that change the program? And how did we have to have collaborative relationships in a way that we hadn't? Or how are we addressing something that, with populations, you can think about, the needs of patients with sickle cell, or patients with cystic fibrosis, or substance use disorder, or veterans. Are you partnering with the VA? So it's about taking hospice and palliative care to the next level of identifying some pieces. And I think the other thing that Denise has said is what's been really interesting is we find programs have gone through program certification, either with the Joint Commission, with the Community Health Accreditation Partners, or with DNV, and they don't think that they're good enough. And it's like, if you've just gone through that to become a program, get certification, and you've done all your QI, you are absolutely ready for this, because it means that you've really done a 360, you've had your team look at that. And so we also really encourage people who are in that process to say, yeah, you're ready. You're probably doing some really neat things, and you're measuring quality metrics, and you're using your team. So that's kind of a little bit about the award. And, we are always excited to see new programs. And the last thing I'll just say is, it doesn't have to be, quote, a hospice or palliative care program. I think the next generation that we're moving to is going to be these palliative care initiatives that could be from a community health center, that could be from a senior health center, could be in adult daycare or pediatric health daycare, where people are doing some integrated things. So, don't think traditional, think creative, progressive, and start looking at your alignments and say, wow, we're doing a lot of collaborative things and we're measuring it and we're thinking about how to use the best people in the best way. So with that, I'm going to turn it over to Jane. And if there's anything I forgot, I'm sure they'll let me know.
Thanks, Connie. And I also want to thank Denise and the Catholic Health Association for your support as a major sponsor of the Circle of Life Awards. So I'm Jane Jeffries. I have been with the American Hospital Association for, it'll be 17 years in 6 days, which suddenly seems like a really long time. And I've been working on the Circle of Life Awards for the past 4 years. So, and thank you all for being here today. This is the 23rd year of the Circle of Life Awards. And we are excited. I'm excited to tell you about the application because we really want to recognize the extraordinary work that you're doing. Of course, because of the overwhelming toll of the pandemic these last couple of years, we just wanted to make the burden of applying much, much less. We really wanted to bring in a lot more programs, from across the country, and did not want the maybe past, potentially scary looking application to put anyone off. So this year we've reduced the length of the application and broken it into 2 parts. So part 1 asks for a brief overview of your program, and then it focuses on your program's major innovations and their impact. And what we're doing here is we're really inviting you to tell your story about how you raise the bar in palliative and end-of-life care. So this part is due May 31st. So at that point, the Circle of Life Awards Committee, which is a committee of many experts, including, of course, Denise and Connie, will review all the Part 1 applications we've received and then invite a subset to continue and submit Part 2. And Part 2 is ask for demographic and other data about both your staff and your patients. We recommend that applicants look at both Part 1 and Part 2 before they begin, just so they know what's expected and to make sure that they have the data that we're going to be asking for. So then after the Part 2 applications are submitted, our committee will meet and have a meeting and decide which organizations will be receiving site visits. And I can tell you, as someone who's been at these meetings for the last 4 years, that these meetings where the committee discusses applications are the most passionate, delightful, agree to disagree type arguments among our committee members. The committee is so excited and determined to shine a light on all of the great programs. So your applications are in such good hands once we get to that point. After site visits, award recipients will be notified in May 2023, which is all the way a year ago, or a year ahead. So I want to note that applicants get a lot out of the application process. It's kind of a celebration of how far you've come. You're kind of taking stock. It should be a collaboration among all your team members. And we've heard from applicants that they really, after submitting an application, they really feel good about where they are and recognize where they want to go after that. So for the applications and information about past winners, it's all located at aha.org/Circle of Life, which I'll drop in the chat. If you have any questions about the application, please reach out to us. You can always get me at circleoflife@aha.org. And thank you. Thank you for being here today to learn about the program.
Great. Thanks both Connie and Jane. And this is perfect because we wanted to have lots of time for Q&A from all of you. Specifically, really nothing's off the table, but specifically since we have Jane here, and hopefully you all saw within the calendar invite, we attached the current application documents. So those are the 2023. We attached an agenda for this meeting, and we also included the honoree booklet from 2017. So if you wanted to read more about the team at Little Company of Mary and the beautiful write-up that Circle of Life does on the winners once it's all announced. I invite you to look at those materials. If for some reason they're not showing up on your calendar invite, just reach out to me and we can email them to you directly. So with that, let's take some time to hear what your questions are. And like I said, there is no silly or question that's off the table. I know many of you might be hearing about this for the first time. Some of you might have applied in the past. So let's hear what you have to say. If you could introduce yourself and say what system or hospital or entity you're from.
This is MC Sullivan. I work with the Archdiocese of Boston, and we have an initiative for palliative care that we have worked with all of the Catholic hospitals and nursing homes in our archdiocese to promote palliative care, educate about palliative care, etc. So we're not a system, we're not even a healthcare provider. But one of the groups that I work with in terms of relationship in our area is a homeless center, and it's specifically a healthcare homeless center. And I'm wondering, would they possibly be a good candidate? I always want to call attention to the novelty of what they do, but also the excellence in what they do.
MC, hi, it's nice to see you.
You too.
MC and I are both a state, and I keep hearing what you're doing. I would say a couple things. First, it's interesting that you are doing this program and it's an initiative and you don't feel like you could apply. And I would rethink that a bit, because you're convening people and you're bringing together in a new way. You might not answer the questions in the same way, but you know, we have received some non-traditional healthcare things that we really feel are valuable. And so one of the things that I think we haven't said is, you know, we're looking for novelty, but we're also looking for replication. And so if you have a program that would be great and other states could borrow it, or other systems, like, don't be shy about that, of saying, oh, we don't have this structure. Doesn't matter. I know some of the stuff you've been doing, because just fair disclosure, MC and I have been involved with some of the Department of Public Health, and there's some connections and things like that. So, you know, one, don't be brave. And two, you know, I think for the homeless part, you know, yes, I'm in my mind thinking of which ones it is. So I'm going to be curious to be in touch with you. But I think the other part is you actually could put in an application together, right? That would be a really strengthened application, that you're both supporting that. And then knowing some of the other work that you have been doing, I think, you know, convening some of the regional group or doing some of that, that all enhances some of this, because sometimes we have people doing direct clinical care, but we have other people who are affecting access by bringing groups together to think in new ways. So please feel free to reach out to me, and I can talk with you further, because you know, that's the type of quote innovation that we're kind of thinking about, that people in a non-traditional way are kind of doing more policy or doing something like that.
Great. Oh, that's really helpful, Connie. Thanks so much. And you may just be hearing from me.
And I'm remembering that some folks, specifically Kyle, there might be others, let us know that they do not have access to a mic. So feel free to also put any questions in the chat, and we will field those too. Hey, Greg.
Hello.
I guess I would ask the question, do people worry about the data, or kind of trying to get some of the information? I guess what I would try to say is allaying some of your fear that a lot of times people have the data, it's a matter of pulling it. Sometimes it's, you know, IT people may help. People may have Excel spreadsheets. You know, we're not going to hold you to exactness, but we're really kind of looking at the breadth of the data, thinking about what is it you're measuring? What is it you're not measuring? And I think sometimes to what Denise said, we have people fill out the application and in filling out, they're like, oh, we now realize we should do X, Y, and Z. Or we didn't make that connection. Or in talking to people, it brings them in a collaboration that perhaps they didn't have, but they're going to start. So I think all of it is positive. I think the other part that I would just say is, when you get letters of support from collaborators, be thoughtful that they're really talking about the collaboration and not just the program. Because we're trying, we notice when things are sort of a standard form that people have been asked to kind of sign. And we're looking for sort of that partnership that's kind of sparked both, or may have been difficult or not sort of expected, and then something came out of it. And we also have programs that say, we moved in this direction and it failed, and then we started something new. I mean, that's also been what people have, when they've been really honest to say everything hasn't been roses. Sometimes they've had some thorns along the way, but that's kind of made them a stronger team. And people will say, hey, we may not be as strong in this area, but we're really strong here. Nobody's going to be perfect on all of this. And that's not what we're looking for. We're looking for, again, places that are innovation, that are replicable, that, weren't so specific to somebody got a huge amount of money and was able to do something versus somebody's using common resources in that way. And Jane and Denise, you might want to add more to that.
Yeah, when I said in the reflection that the program at Little Company of Mary was not flush with resources, I definitely meant that. And again, the process for them, it was interesting because they applied the first time and got a citation of honor, but didn't win the thing that their leader champion wanted them to win, which was the main award. But the benefits that came out of that, it sharpened them as a program, as has been said, just by going through the process of applying. But then I think there was this reciprocal back and forthness between them and the leadership, and it paved the way for some additional resources to come their way. Again, not temporary resources, but actually FTEs. And then because of those FTEs, they were able to level up and build out a more mature and well-rounded program so that the next time around, when they applied, they had a program that was far exceeded where they were the few years prior when they had applied the first time. So yeah, it's tricky, I think, with, I know many programs have outpatient, but it is the funding sources, outpatient palliative care, but the funding sources are a little more tenuous, maybe some temporary or grant monies involved. Again, to echo what Connie's saying, I would say don't let any of those things stop you from applying, but just be mindful that the way I like to think of the award is that the goal of the award is to shine a light on good work that will inspire other programs to do the same. And so again, not perfect, but progressing, not arrived, but working your way there. And as I think is exemplified in all the winners, but in my personal experience with Little Company of Mary, being that kind of team that is always happily discontent with what you're doing. You can always see a way that you can improve, do a little bit more, do what you're doing a little bit better. I think that puts you in a very good mindset to apply.
If I could just jump in and add one more comment about collaborations. One other thing about if you've we have found that the programs are really strengthened by their collaborations with organizations in their community. So don't look at it as we weren't able to provide this, so we had to turn to these people. The committee always views these as, the value of developing these relationships and bringing more kind of programs and contacts and just care into the larger program. So your collaborations, we had, I've been trying to drag the 2020 booklet into my little chat box and I'm failing, so I'll just give you a quick overview. But I mean, we had programs in 2020 where, they had a really powerful program because of the deep collaboration with the local PACE program. And that, I mean, it helped everybody. And so don't look at those spots where you might feel you're lacking and so you had to turn to outside sources. Those are the collaborations that we celebrate.
For those of you who are thinking of applying beside MC, are there other worries that you have, or you're thinking about a time commitment or something like that? I think, Jane mentioned that we have looked at what's necessary for an application to really give people a sense of initial part of what we're looking for, and then more information of what we would want if they're going to go forward. I think the difference is this isn't writing a grant application. It is looking at some thoughtful areas about your program and who you're using, and how is the IDT represented. And IDT isn't all health clinicians. It could be community health workers. We're looking for innovation in that area. It could be volunteers in the larger sense of a volunteer, not just how a hospice would describe a volunteer, because I think we know the whole role of volunteers, here we are in the 21st century, has changed from, the hospital that I worked at, from the mostly women in pink salmon jackets who were wives of physicians, to, the newer generation who is creating data banks and doing, people's data collection for QI, or making phone calls. So, those are also the things that people sometimes don't think about innovation, that it's, again, looking at your community and who are some of the social service providers that you may be working with: translators, legal services, nutrition, transportation, working with some of the disease-specific organizations, looking at your community in terms of obviously faith-based communities, but I would even say looking at school systems. So what are some of those things that you haven't even thought of, like, oh, wow, not a lot of people do that, and that might be your unique quote to your community, unquote. But on the other hand, it could be something that people say, oh, we could think about doing that, and might not be exactly the same, but the model would be the same. So that's where we're kind of trying to help people think broader than, this is the palliative care team, we get a referral, it goes from here to here, to, we are, as you all know, going to be inundated by 2030, all baby boomers will be over 65. What is your community planning? Maybe you're lucky and you're in a community that's not weighted towards that, and that's going to be a whole different thing to think about. Or you might have some environmental things that have caused people to have certain diseases, beyond cancer, like CHF, COPD. I think COVID made people do a lot of creative things. So it's really thinking about those types of things.
One thing we haven't touched on, and I kind of feel like I'm in the PBS phone-a-thon thing by adding this, but the people those who are honored by the program, the winners and those who receive citations, those folks are invited out to the AHA Leadership Summit, which next summer is taking place in Seattle. And we have the presentation of the award. We usually do a sunrise session, like a panel among all the honorees with our committee chair moderating. And then we have a celebratory luncheon for all friends of the Circle of Life Award, all of our sponsors and funders and the honorees that year and their teams. It's a really joyful, fun event. So it's just one more thing to consider as you're considering whether to put together an application, is that it's a nice meeting every year for the palliative care community to join us out at the AHA Leadership Summit.
For those of you who have access to the full Teams functionality and the reactions, can we get a sense of, with a thumbs up, of who might be, even if you're a capital M maybe, thinking of applying versus strong yes? If we could group all those people together with the reaction of thumbs up. I'm really curious if some of you, Kyle, great. I'm so glad you're still interested in applying. Really, really excited about that. Kyle is kind of the inspiration for this call because he and I were chatting, and as I was listening, I was hearing a lot of innovation happening just organically in their hospice in Oklahoma. And I thought, I just asked him, have you ever thought of applying for the Circle of Life Award? And he said, the Circle of what? so we talked, and we're going to have a conversation, just he and Jane and I. And then we realized, no, we need to bring all y'all into this conversation. So I'm really glad to hear that, Kyle. Anybody else? I'm looking at for any other thumbs ups, and this year or next. Again, you heard my story. You heard how for many teams this is a multi-year endeavor. We get it that most of the people we're talking to are primarily clinicians. A few have protected time to do things like this, so things sometimes move more slowly. I feel like an auctioneer MC. Did I see your thumb kind of go up? A maybe. Okay. And Kristen, maybe next year. Great. Love to see
Definitely
that.
something to think for.
Yeah. Good. Yeah. And Kristen, remind me where you are. Lou, great. Looking at it in the future. Lou, do you remember, or Jane would probably know too, or Connie, has Trinity applied in the past, won in the past? I don't know all 20-year history like you two do.
I need to look that up, which I can do pretty quickly. So I'll get right back to you.
I think there was one part of Trinity. I don't think it was the Trinity system, if I remember correctly. But
Okay.
Jane has the Wizard of Oz view of all of this.
Okay. Okay. And Kristen's, great, part of Covenant Health. Okay. Excellent. Now, yeah. Great. And yeah, I think Mount Carmel, Lou, I think you're absolutely right. Yes. So that would be fantastic. And Amy, you're in italicized, maybe. Love the specificity there. And Kathy is interested too. Now, I know where Amy's from. Kathy, where are you from? You can type it in again, or if you want to unmute.
I'm from Avera in Sioux Falls, South Dakota, the Avera systems.
Of course. Oh, Kathy. Yes, yes. Oh gosh, you all are, okay, so I just have to repeat the words of my reflection. Too much humility can get in your way. All of you, I think, would make excellent applicants. I know what you are out there doing, and you are really pushing the edges. You're expanding. You're reaching out to populations in your community that I think it's just hard. We all operate within our own areas, our own communities, our own bubbles, our own silos of sorts, and we maybe don't get a sense of not everyone is doing palliative care and adding and doing the additional things that you all are doing. So yes to all of those. Okay, and another of St. Annette is also with St. Joseph of Nashua. Great. So you guys, you have a dynamic duo to tackle this together. That's fantastic to hear. And for those of you who are not even an italicized maybe yet, you know, keep on. We'll have more information coming out about these that you'll receive. Keep it on your back burner because you just never know when you'll have time or bandwidth. I'm not sure exactly what the biggest barriers are. Oh, here comes Mark. But we'd love to help you surmount those barriers. Hey, Mark.
So sorry.
It's okay. We recorded. I'll send it to
Oh,
you.
good. Good. Just patience. Yeah.
We're just getting a sense if anyone's a maybe to applying in the next year or so. And I won't put you on the spot since you just joined, unless you happen to know your answer.
Well, we've been thinking about it, but we've looked at the requirements in the past, which just can be kind of daunting, you know, and a commitment. Yeah.
Well, and we hope with the shorter application this year that people who might have been put off in previous years by the sheer amount of work it took to apply, give us a new look, and maybe you'll find that we aim to be less burdensome this year. So take another look.
I will. Absolutely, I will.
And I would just say it's a balance because we do need information. We do, we have a committee of 12, Jane, and we all read these applications really comprehensively, and we all notice different details. And so, the information, we know that people are doing good care and they're following hospice conditions of participation, or they're calling their state star. That's great. And so if you're doing that, great, but we're kind of looking for above and beyond that, just meeting requirements. And so, while I know I can hear that you've been daunted, Mark, by the information, on the other hand, it's that information. It's funny that when people are writing this, they put forth a personality, and I would really suggest, how about that word? Suggest that when you're doing this, it's a collaborative process. We can tell when it's a grant writer who just takes it and fills it out, and there's a disconnect between.
We don't have that, so yeah.
But I'm just saying, when there is, or a development person who's not talking to the team, because we'll figure out, wow, it's interesting what's not here. So, using it as a conversation piece, I, have often suggested to people the way to kind of start this is actually when you have your business meetings and you're looking at quality improvement, to look at some of the questions that way, to sort of say, hey, where are we with this? Nobody's ever asked us this question. And that kind of helps people kind of go, oh, we have that, or we even need to figure out how to get access to that, even if we don't want to do the application. Or that's interesting, because it's all about, it's apples and oranges depending on where people are applying from. And we're very aware of that. So we would never hold a long-term care setting to the standards of an inpatient palliative care team you know, that's been around for years, but long-term care is sort of new. And so, you know, is the long-term care really developing a palliative care program? Is it a hospice that's coming in and helping them move the needle? I mean, those are all possibilities, I think, of just thinking about that. So.
Well, Jane or Connie, unless you thought of any other pertinent information that we forgot or, okay. I want to thank you again, all of you, for joining us. I will send out the recording after this meeting, and the program lead that I mentioned from Little Company Mary that I told this story of on him in our reflection is Dr. Glenn Komatsu, and he has graciously volunteered his time to have discussions with any of you all who want to kind of ask the questions that you might felt like, I don't want to ask that here. So I can connect you with him if you reach out to me, and we could make those connections happen. I'm reminded by Lou that there are some other folks within the CHA membership who have also gone through the process. So I will see if I can rustle some of those folks up too. And we'll, in addition to Jane and Connie, who are here to help us with kind of the practicalities and the vision casting for this, if you will, we've got some in-house experts and some folks who are willing and would love to walk alongside other programs and help them succeed. So with that, I will say,
Submission.
pardon?
When is the deadline for submission?
Yeah, Jane, do you want to recap that real quick?
Sure. It's since the application's in two parts, part one is due May 31st.
Okay. And I apologize for jumping on here so late.
No problem.
Usually I'm very much on time, but today I couldn't. So
Yeah, no, we
okay,
understand.
so great.
Yeah, and as I mentioned, hopefully everything, the application, previous honoree booklets we weren't able to drop in the 2020 booklet into the chat. I couldn't get that to work either, Jane, sorry, but you should have the application in this calendar invite. And as Jane said, it's two parts. It's, you know, similar to other processes where part one is almost like a LOI in a way. I think we can think of it as that. So much more streamlined, much less, I think an idea, lower time commitment potentially to get that first part ready. So we hope that adjustment really makes what feels to be a more accessible on-ramp for you all to at least test the waters. What have you got to lose?
Right.
Yeah.
I love it.
Yeah. All right, everyone. Well, thank you so much. Watch for an email with the recording, and we'll be in touch. Take care.
Thank you all.
Yeah, thanks.
Thanks,
Thank you.
Denise.